As children get exposed to the world, expect 6 to 8 colds a year, or more if they go to daycare. Most colds are viral, and as we've learned with COVID, there's no medicine that will make that go away. Our job as caregivers and physicians is to support children through their symptoms and watch for any complications. Hello, my name is Dr. Monica Flores. I'm a pediatrician in South Florida since 2001. If bottle or breastfed, children get frustrated by not being able to suck and swallow due to the stuffy nose. You can drip or spray saline water in the nose to help them thin the mucus. They can then swallow the mucus and you'll see it in their poop, or you can then suction it out. But after one squirt, most babies will start to resist that process. That's why I prefer to use AYR saline gel. Apply a pea-sized amount to each nostril every 1 to 2 hours as needed to thin the mucus and help them breathe better. Another way to provide humidity to the nose is via nebulizer. That blows cool mist directly into the face and nose and helps thin the mucus. Under the age of 6 months, I do not recommend any oral cough and cold medicines. After 6 months of age, for runny nose, watery eyes, or sneezing, you can give an antihistamine, things like Zyrtec, Claritin, or Benadryl. The dose is dependent on the weight. Make sure to ask your provider. Some children get sleepy and some get irritable on antihistamines. I recommend trying the medicine during the day to see what effect it will have on your child. Cough and cold medicines are not recommended, although readily available and heavily prescribed. Talk to your provider, and if you choose to give a cold medicine, observe your child and see if it actually makes a difference. A child's first cold can last 2 to 3 weeks because their immune system has never seen an infection and needs to learn how to fight it. Even with future infections, runny nose, cough, and congestion can last a week or more. When to worry depends on age. For any child 3 months and younger with a cold, runny nose, cough, congestion, fever, nausea, vomiting, diarrhea, any symptom, immediately seek medical care, either via a phone call or a visit to your provider. Between 4 and 12 months of age, if the baby is eating and drinking, active and playful, you can treat at home. Seek medical attention if you have fever higher than 100.4, either rectal or oral, for longer than 3 days, or any fever with listlessness, nasal congestion and discharge no matter what the color longer than 7 days, a cough that is progressive, today 3 times, tomorrow 13, the next day 33, a cough that wakes the child or you up at night, a productive cough, they gag or throw up food or mucus due to the severity of the coughing, a cough that gets worse with activity or laughter, comes in attacks, paroxysms where they can't catch their breath. If there's any wheeze, whistle, or chest congestion, all of that needs medical attention. Any cold that causes a child to not play or eat or interact with you needs to be evaluated ASAP. Most children do well with their first cold, but due to their immature immune system anatomy, small nose and lungs, and inability to communicate their symptoms, it's always better to have them examined for complications like ear infections and bronchiolitis if you are worried.